Hello everybody and welcome to Enhance Health. In this channel, we talk about all things physical and mental health. In today's discussion, we're going to be talking about why having a comprehensive physical exam is very important. I know that in some parts of the world, it's a given. You go to the doctors at least once a year to get your physical done. But in some parts of the world, like in some parts of Africa where I'm from, people only go to have a medical appointment if they're perhaps sick or there's something wrong with them. That's when they go. So I do want to encourage you today to make a time to have a comprehensive physical exam regularly. So if you're in your 20s, it's usually between 20s and 30s. It's recommended that you have a comprehensive annual exam every 2 to 3 years. If you're in your 40s, you can have one every 1 to 2 years. And if you're in your 50s and up, it's recommended at least a yearly exam. So this is part of the self-care that we're talking about. It gives you a benchmark of where you are in regards to your health. So what happens during this comprehensive exam? During this comprehensive exam, you are going to be examined totally from head to toe to figure out if everything is okay. They will check your blood pressure, check your blood work, and then there will be several discussions that will be had during this appointment. They will discuss with you things like having your cancer screenings done. If you're a woman, you'll probably get a referral to have cervical cancer screening done, which is your pap smear. And for everybody, depending on where you are, from 45 years and up, or if you have any issues with your bowel, you may be recommended for you to get a colonoscopy done. Also for females, this is where you will get a referral to have a mammogram done for breast cancer screening. So during this appointment, several things are done. That's why it's very important that you make sure that you are getting this done on a regular basis. Another thing that will be discussed during this appointment will be the vaccines that you need. I know regularly during the fall, winter seasons, we'll encourage patients to get their flu shots done, but there are other shots as well, depending on your age. So this is what you will discuss. This is what you will discuss with your doctor, with your primary care provider, who will run through everything that needs to be done. So the important thing with this comprehensive exam is that, like I said before, it gives you a benchmark of where you are in terms of your health. Now, a lot of people say, oh, I feel fine, I feel okay, there's nothing wrong with me, I don't need to go to the doctors. But that's a mistake, because a lot of illnesses that we are seeing now do not have any signs. We have the ones that we say are silent killers. Some people may have very high blood pressure and they would not know, and they'll just be walking around with it until one day, God forbid, something happens, then they have a stroke or heart attack, and they just collapse. So this is one of the reasons you really need to have yourself checked out regularly, once a year, every 6 months, once in 2 years, depending on what your medical provider tells you to do. Another important thing to be done is also the blood work. It's very important. This is how we can check to see if you have diabetes, the sugar disease, which is the diabetes. So these are the things, or even high cholesterol. If you have high cholesterol, there's no way to tell physically that you have high cholesterol. These are things that have to be determined with your blood work. So if you do the blood work and it's determined that any of these things are elevated, then your doctor will discuss with you methods on how you can bring them down. So you can either go on a lifestyle change, including diet and exercise, or depending on the severity of the labs, the abnormality of the labs, they may put you on medication right away. So I also want to share with you today 5 things that you can um, ask your doctor during this medical appointment. So a lot of patients come to see me, and when they come, they say, "Oh, I've forgotten what I wanted to ask you. I know I was having an issue, but I've forgotten what it was." So you need to prepare for this appointment by thinking through what are your issues, what are the problems that you're having that you want to discuss with your doctor, with your nurse practitioner, with the medical provider, physician assistant, whoever you're seeing that day. You need to write it down, use your phone, paper, whatever, write it down and bring with you your list that day. So that's one. The second thing you need to discuss is the medications that you're on. If you've already been put on a medication, you need to go through those medications again. Ask the provider, do I still need to take these medications, and what are they for? I can't tell you how many times I've had patients that I ask them, okay, what medications are you taking and why are you taking them? Oftentimes they'll tell me, oh, I'm on this medication, but I don't know why I was put on it. So it's important that you know what you're taking and you know why you're taking them. You have to take control of your life, of your health this way. So that's the question number 2 that you're going to ask. What medications am I taking? Why am I taking them? And do I still need to take them? So the third question you need to ask, you need to find out how you are doing in terms of your blood work. I know that this is a given. A lot of times the provider will go through the labs, the recent labs that you've done, to explain to you where you are in terms of the blood work. But if that doesn't happen, then you need to take the initiative and find out how your blood work are for that appointment. Another thing you need to do is to compare how it was the last time you did it. So let's say they checked your cholesterol level this time. You need to find out how it was the last year that it was done, the previous time that it was done, and compare it to today. The reason is that you need to know if the changes you have made, it's working, if the medications that you're on are working, if there are any changes that you need to make moving forward. So let's say last time the blood work was done and your cholesterol was higher than now, then you know that perhaps you need to get on a medication if you're not on one, or maybe they need to increase the medication that you're currently taking. It will also help you to know about the lifestyle changes that you need to make. Perhaps you need to watch your diet more, maybe exercise more. So it gives you that power to know that, okay, I need to make this change here because this is what happened with my blood work the last time that it was done. It actually has gotten worse instead of getting better. So the third thing is, if you are being told that perhaps there is something that you have, maybe it was the first time that you're being told, oh, your blood pressure is high, you do have hypertension, or maybe you've been diagnosed with diabetes, or you're just being told to watch your sugar. If there is something that the provider is telling you that you don't understand, you need to ask them to repeat themselves. Just tell them, thank you, but can you please explain that again? Because I don't understand. Believe it or not, we want you to understand what we're telling you. So it's up to you to stop the provider and ask them to explain again. So the fourth thing is you need to ask, what should I be doing before my next appointment? So if they have told you everything that you should be doing, or everything that happened in this appointment in terms of your blood pressure, perhaps they say, oh, it's a little bit elevated. What should you be doing to improve it? So what can I do to improve my health before I see you next time? So this is another question that you should be asking. And then finally, the last question is, when it's my next appointment? So depending on what your physical exam shows, depending on what your labs show, will determine the next time you will come back for an appointment. So if your labs are perfectly normal, your vital signs are all normal, your blood pressure, everything look normal, you may be told to come back in another year for a physical exam. But if they eventually find out something, perhaps your sugar, blood glucose level it's elevated, it's high, or your cholesterol is high, or there is something wrong, the provider may tell you to come back in 3 months or come back in 6 months, especially if they put you on a medication. They will require for you to come back a little sooner to repeat the blood work or repeat that blood pressure to see if the medication you're on is working. So these are the tips I wanted to share with you today. To recap, I just mentioned to you the reasons why it's important that you should be going to have a comprehensive physical exam regularly, depending on how old you were. Usually from 40 and up, or 50 years old, you should be seeing a medical provider on a yearly basis with vital signs and labs done. I also explained to you all the questions that you need to ask your provider during this appointment. So I hope this has been helpful. If it is, please give it a thumbs up and share with others who you think may benefit from this discussion today. Thank you for listening, and see you in the next video.